There are a few medicines that I prescribe really frequently in clinical practice, and I call them my top three sort of grandma medicines because there's nothing really new and fancy about them, but they're tried, tested, and true. Great interventions to use for overall health, but generally these are focused on the digestive tract. As a sort of gut-focused naturopathic doctor, gut whisperer, um, I use these all the time. So I want to talk today about digestive bitters. Digestive bitters are bitter. That's why they're called bitters, and they're good for digestion. So digestive bitters sort of explains a little bit about them. Um, I would say they act more on the upper digestive tract. So we're talking about the stomach, the liver, gallbladder, pancreas, maybe duodenum. These sort of areas are more the areas that we're going to try and impact with digestive bitters. However, because of the interconnectedness of everything, you can see things that benefit the upper GI benefiting the lower GI. So I had a patient tell me recently it worked like Imodium for them. So their looser stools have decreased because of using digestive bitters. Wouldn't have guessed this, but hey, that's clinical practice, and yeah, the best teachers are the patients. So digestive bitters, the ones I normally use are Harmonic Arts herbal bitters or St. Francis herbs Canadian bitters. Probably going to offend the herbalists, purists out there, but generally these formulas are all probably pretty good. The key thing is that they're bitter, and so some of the herbs in them make a big difference. I'm really looking for gentian to be in there, Gentiana lutea. That is the most important one. And then there's slight differences between the other ones, but they're bitter. And it seems like this bitter taste is pretty critical to how they work. So you've got bitter taste receptors, obviously in your mouth, but you have them further down in the GI too. So I think for the full effect of bitters, they have to work in the upper part of the digestive tract. But you could take pills probably or capsules, and it may have some influence. But I would say superior effects would be seen with using the bitter tasting herbs. So I just want to tell you a couple things about safety precautions or whatever. A lot of these safety precautions are a little extreme in my view. The main things I'm looking for when I have a patient who I've prescribed bitters for is do you have any ulcers? Do you have any really acute stomach irritation, and are you pregnant? And if those things have been discussed and they're not a problem, then usually we'll go ahead with bitters. But we want you to be careful if you've had any sort of issues with bile duct or intestinal obstruction, low, maybe low potassium, high blood pressure, maybe kidney or cardiovascular disease, allergies to any of the herbs in them, which is often the Asteraceae or Compositae family, the daisy family, or maybe sometimes the Apiaceae family, which is the carrot family. So obviously, if you have any issues with those ingredients, then you don't take bitters. Another really obvious thing that I say to everyone is if you have problems taking anything, just stop taking it. That's fine. Um, but generally well tolerated, but the taste is not great. So a lot of people have problems with the taste. Again, with all supplements, all herbs, all medicines, I generally say, if you have any issues with it, just stop. And so normally we take bitters around, around mealtime, traditionally before you have your meals. But in real life, sometimes you only have it before breakfast and lunch because not everyone's going to bring their bitters to work. Only the most hardcore people will, which is cool. Um, or you keep bitters in several places, which is what I do. I have some at work and I have some at home. So generally, you take 4 milliliters 3 or 4 times a day, or in my, I just try to make it simple. The little dropper, you just squeeze it 4 times, 1, 2, 3, 4. That's sort of your max dose. But some people do really well with even less of a dose. So you can do even just a tiny little bit of bitters, and maybe that's enough for your system to react accordingly. Because remember, the bitters are just stimulating something in you, stimulating that upper GI to do its thing, to make more acid, to make more bicarbonate in the pancreas, to make more bile in the liver, and for the gallbladder to contract. So, hence the problem. Sometimes, if you have a blockage in the gallbladder or the common bile duct, you have to be careful with bitters because you're kind of forcing more stuff to come out. But if that sphincter of Oddi, and remember I always talk about the mechanical perspective too, you have to address the mechanical aspect of the tubes. that's where this comes in here too. So you don't want to do bitters if you have like a blockage in those tubes. But I'll usually find those in clinical practice. That's usually part of my assessment, but maybe not commonly assessed by most practitioners. So yes, that should be enough information for you to move forward with bitters. Um, safety wise, just again stop if they're a problem, but they should increase your capacity to digest. So let's move on to some of the benefits. Maybe increase that capacity to digest. So some people have issues with the stomach proper, and one of the signs of that would be like they can't digest heavy protein meals or meals that require a lot of breaking down. What's the essence of the stomach? It breaks stuff down, right? So often people who can't digest something normally, they'll take bitters and now they're able to digest. So it's kind of like just like a digestive flex for the stomach and upper GI. So as one of my top three grandma medicines, use it all the time. Thought I'd make a video because I say it all the time. And and if you don't know, now you know.